Hi, Kevin Henry, the managing editor for Dental Economics, here today at the Blue Apple Health booth at the Chicago Midwinter Meeting here in Chicago, Illinois. And speaking of Chicago, talking with my good friend Danny Bobrow, President and CEO of American Dental Marketing, based here in Chicago. So, one of the things I wanted to talk to you about today was obviously marketing and maybe some of the trends that you're seeing in dentistry right now, what's been affected by the economy, what hasn't. I mean, give me some ideas what you're seeing right now.
Sure. Delighted to, and thanks for the opportunity, Kevin. It seems like the main thing that dentists are really concerned with and focusing on nowadays has to do with the internet and specifically social networking and how to make that work for them. And that's certainly an important component, and an increasingly important component of a dentistry marketing plan. I do find that it's very important that when someone does decide to delve into that or embark on that path, that they understand a few of the basic principles behind doing it effectively. Done right, it can help grow your practice, but there are some, as I said, key components to making sure that it's done right. The process to set up a profile and to invite people to either join as friends or fans or whatever the case may be, and then making sure that what you communicate is of interest and doesn't come off as too commercial, overly commercial. Otherwise, you can actually alienate your audience. It can also be a monumental waste of time, and that's something that we really advise our clients to be careful with. And at the same time, remember the basics. There are things that you can learn and remember. I recently wrote an article about that cited 5 examples I had with 5 different merchants around my office, literally within a 2-block radius, that showed how you could learn just by observing how other merchants in other industries and professions interact with their clients, customers, patients, as the case may be, and see how you can apply that to your own office situation. So definitely continue to become familiar and comfortable with the idea and opportunities behind social networking, but don't lose sight of the basics and think about always viewing the patient's experience from their perspective. Just walk through your office for the first time, maybe in a long time, from the patient's side. If you're always going through the back entrance, you may really lose sight of what the patient is perceiving when they come into your office. And likewise with driving by. Drive by your office during the day, after hours. How does the office look? Are the shades askance? Is the backlit on the sign no longer working? Is a bulb burned out? These are really subtle but important ways to make sure that you're reflecting always a positive practice image and something you don't want to forget about.
Good point. And I think a lot of people sometimes will forget that really everything in your practice is marketing. I mean, that very first impression, like I said, a burned out light bulb, an unkept reception area. I mean, all that is truly bad marketing for your practice, right?
Absolutely. For many years, a lot of dentists said they didn't market. And what they didn't realize was that they were marketing. They just didn't control the message. And quite often, the message that was being conveyed did not reflect that yours was a caring professional involved with the community practice. That's exactly right.
What do you think is the one marketing blunder, maybe, that you see more dentists make than not?
That's easy. Somebody a while ago said that 50% of my advertising is wasted, and I don't know which 50%. And unfortunately, in dentistry, it could be higher to 90%. The biggest blunder is not taking advantage of the technologies that exist now, the cost-effective technologies to track, monitor, and evaluate your various marketing strategies and tactics. Knowledge is power. And while you'll never be able to attribute perhaps with 100% reliability the source of each patient, using tracking telephone numbers, vanity URLs, and other techniques really make it possible to attribute the response and to know what's working and what's not. And, you can maximize return on investment one of 2 ways, Kevin, and you know this. You can either increase the return or decrease the investment, because return on investment is just a fraction, with return in the numerator and investment in the denominator. So if you're getting a return, let's say direct mail, and you're spending X thousand dollars on it, and your tracking determines that your response is only coming from 50% of your target, you literally could overnight reduce your investment by half and accordingly double your return on investment. So I would say that's the thing that doctors should really look for. Track, 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 and don't rely on anecdotal tracking, as I call it. When you ask your patients who to thank for referring them, it's not their job to do the tracking, and what they'll tell you is the last thing that motivated them to come in. And we can prove this because our tracking, we record the calls that we track for our clients, and hardly a week goes by where I don't hear somebody saying I was referred by a friend or I'm on your insurance plan. And in fact, the only reason that they got that phone number was because they got a direct mail piece. So it was the mailer, but the mailer didn't get the credit.
Interesting. And speaking of marketing, we've got to thank our friends here at Blue Apple Health for hosting us today, and we appreciate that.
We absolutely do. Be on the lookout for them. They do corporate wellness screening. They do attend various dental meetings around the country, and they're very good people. We hope you'll support them.
So, Danny, thanks for your time.
My pleasure, Kevin, always.
Thank you for watching.